Here, I want to talk, of course, about the COVID crisis and that Delta variant. We learned a little bit earlier today that 75% of U.S. adults had actually received at least one dose of the COVID-19 vaccine. Of course, this, comes against the backdrop of the rise in the Delta variant. And you have Goldman Sachs economists revising down their forecast for economic growth because of concern about just how much that Delta variant could sort of hamper economic activity. Dr. David Dowdy, he's an associate professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health, joining us right now to talk a little bit more about this. Dr. Dowdy, I am curious as to this milestone that we recently reached, 75% of U.S. adults now having gotten their one shot, and the rise of the Delta variant, and how much the rise of the Delta variant may have contributed to the uptick in vaccinations.
Yeah, well, we've certainly seen an uptick. I think, as you mentioned, we've seen a big uptick in the number of people getting that first shot. I think the key here is that for those people who've gotten that first shot, we need to make sure that you get the second one as well. We're still less than 2/3 of adults at getting fully vaccinated, and especially with the Delta variant, the key is that second shot matters.
Well, for a lot of folks now thinking about their second shot, we're also being told that we may need a third shot, these so-called booster doses that effectively the Biden administration wants us to take. And now we've heard from Fauci and a few other health professionals saying that this may actually be the next course of action. Is that what you say?
Well, so I think that on an individual level, getting a booster probably helps. But it's really that the second shot, the full vaccine series, that makes the biggest difference. And again, I think that it makes sense to get boosters, but I don't think that that's going to be the priority as far as getting this pandemic under control. It's really getting people up to that first full vaccination series. So the first two doses that are most important.
Well, let's talk about it getting under control here. I mean, I've seen some data and some commentary that seems to suggest the Delta variant itself may have actually peaked. Is that what you're seeing in your data?
Yeah, so when we're talking about cases in general and the Delta variant in the U.S., they're basically the same thing right now. And cases have, it looks like, peaked in those areas of the country where this most recent surge started off. So Arkansas, Missouri, Louisiana, et cetera, right? But they're still quite high, and they're still going up in other areas on that periphery. So places like Ohio, for example, are starting to see increases in their cases now.
When we talk about, I guess, the variants here, there's been a general perception here that with each variant, while I guess it gets scary to some of those folks who are lay people, there's a general sense here that maybe these other variants won't necessarily be as deadly, or they won't be as severe as maybe the original variants. Is that my understanding here?
Well, I think that there's no reason to expect that future variants will be more severe, right? There's no advantage to this virus to killing people. All it wants to do is transmit from one person to the next. So there's a lot of pressure for new variants to be more transmissible, not necessarily a lot of pressure for them to be more deadly. So I think that while we can expect any future variants to be a bit more transmissible, there's no reason to think that they're going to be more severe in the disease they cause.
Any sense here as to how long we're going to have to live with this, doctor?
Well, I guess it depends on what you mean by live with this, right? I think hopefully future waves of this disease are going to be much less severe than the last few that we have seen. But we're probably still going to be navigating smaller waves of this disease for months and years to come.
And does that mean like regular shots or boosters going forward for those of us who are vaccinated?
Yeah, so not necessarily. What the jury is really still out on is what sort of intervals are needed between booster shots, right? We expect that at some point people are going to need boosters, but there's a big difference between saying people need them every 6 to 8 months versus every 3 to 5 years, right? Hopefully, we'll see that immunity lasts longer than just a few months, and so we're not talking about getting a new shot every few months, but really more every few years.